Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about when do you stop using antibiotics? Because it's a complicated issue and it's different for everyone. So, not all patients choose to use antibiotics, but for the ones that do, um, we use antibiotics to treat the various organisms: Babesia, Bartonella, Ehrlichia, Anaplasma, Rickettsia, Tularemia, Q fever, Lyme, Relapsing Fever. I mean, there's a lot of different infections. And we do so by rotating antibiotics and by pulsing antibiotics. And basically, the idea is we want to try and bring down the inflammation and we want to try and reduce symptom severity. So that's the idea behind using either herbs or antibiotics, is to lower the inflammation and lower the pathogen load. So for a patient that chooses to use antibiotics, let's say they had Lyme, Babesia, and Bartonella, and they had been infected for 10 years. It's hypothetical. Although a lot of my patients have been infected for many, many years. The infection has become chronic, so it's very deep in the tissues, and we just have to keep treating until there are no symptoms, 0 symptoms, and then you treat for 3 months after that, and then you stop antibiotics. And generally, you go on to just herbs. And you do herbs for 6 months, and then you totally stop. Now, when you go on herbs, if you start to relapse, then you go back on antibiotics till all the symptoms are gone, and then 3 more months, and then go back on herbs again. This is the way that Dr. Jones taught me to treat, and it has worked extremely well for 95% of my patients, those that choose to use antibiotics. And some of my patients, they just like to use herbs, and that's fine. I'm just talking about, patients ask me, well, how long am I going to have to be on it? I have absolutely no idea. And the reason is, I have no idea when you test positive whether or not you have 10,000 organisms or if you have 100. And that matters, obviously, right? The more pathogen load you have, the more likely you're going to need antibiotics for a longer period of time because the infection is seated and it's deep in the tissues. So, for patients that do herbs, you rotate herbs in the same way that you rotate antibiotics, and you treat until there's no symptoms. Then you gradually reduce the herbs over time until they're off. You look to see if they relapse. If they relapse, then they go back on the herbs for 3 months and start to wean off again. And that process continues until there's no symptoms. It is a myth to think that somebody who's been infected for 10 years is going to be cured. I have seen it, or so I think, but it's pretty rare. More likely, patients will go into remission. And remission is when the organisms go dormant and therefore you have no symptoms. So that's a much more likely scenario for most of my patients, and one that I strive for. You will never hear me use the word cure because I don't want to say something that I'm not sure that I can deliver. So basically, we stay on antibiotics for X number of months or years until there are no symptoms, 0 symptoms. Then 3 months past that, then you transition to herbs. If you relapse, you go back on antibiotics and again stay on it until no symptoms, then 3 more months, and then herbs. And that seems to be a really great way to make sure that patients are really settled into remission. So I hope you found this information useful, and I hope you have a wonderful day. Take care.